Welcome to your OBGYN visit. My name is Jenny, and I'll be assisting you today. How are you feeling?
صباح الخير، أنا بخير، شكراً.
That's great to hear. So, I understand you're interested in exploring contraceptive options today. Is that correct?
أي صحيح. أنا مهتمة بذلك.
Sure, there are several contraceptive options available. Each one has its own benefits and considerations. Let's discuss some of those options.
نعم. لهاي السبب أنا جيت اليوم مشان أقرر.
Yes, based on your health history and preferences, we can discuss which option might be best for you. But first, can you tell me about your menstrual periods? Are they regular, and do you experience any abnormal bleeding or pain?
الدورة الشهرية منتظمة عادة، لكنني لاحظت تأخراً في الدورة الشهرية هذا الشهر، وأشعر بآلام بطن خفيفة ويوجد ألم وحرق عند التبول.
Thank you for letting me know. Now, can you tell me about your pregnancies? How many times have you been pregnant, and how many children do you have now?
أنا كنت حامل مرتين، وعندي طفلين الآن.
Have you ever experienced any miscarriages?
نعم، لقد تعرضت للإسقاط مرة واحدة في الماضي.
I'm sorry to hear that. Were your previous pregnancies full term, and were they delivered vaginally or by cesarean section?
ولدت أطفال الاثنين في آخر الشهر التاسع، وكانت ولادة طبيعية. هل يمكنك التحدث عن فعالية كل طريقة من موانع الحمل وكذلك عن أي آثار جانبية محتملة؟
Of course. Let's start with birth control pills. They are highly effective when taken correctly and can also help regulate menstrual cycles. However, they may cause side effects such as nausea, headaches, or mood changes.
سمعت أيضاً عن اللاصقات. هل هي فعالة؟ وهل لها أعراض جانبية؟
Yes, patches are also highly effective. You apply them to your skin and change them weekly. They work by releasing hormones into your body to prevent pregnancy. However, they may cause skin irritation at the application site and can also have similar side effects to birth control pills.
طيب، أو ممكن تكلميني عن الحقن؟
Absolutely. A contraceptive injection is a shot that you receive every few months. It's highly effective and convenient for women who prefer not to take a daily pill or use other methods regularly. However, some women may experience irregular bleeding or weight gain as side effects.
فهمت. شكراً للمعلومات. وماذا عن اللولب؟ في بعض من الصديقات استخدموه. هل هو جيد؟
IUDs are a long-acting, reversible contraceptive method that is inserted into the uterus. They are highly effective and can last for several years, depending on the type. They offer the advantage of not requiring daily attention, and fertility returns quickly after removal. However, some women may experience cramping or irregular bleeding, especially during the first few months after insertion.
شكراً لكل هاي المعلومات. في الحقيقة أنا محتارة ما بين اللاصقات والحقن. إذا كان ممكن تعطيني معلومات أكثر عنهم، وكيف أقدر أستخدمهم؟
Certainly, I'm here to help you decide what is best for you. Let's start with the contraceptive patch. This method involves applying a small patch to your skin once a week for 3 weeks, followed by a patch-free week. It releases hormones similar to those found in birth control pills, preventing ovulation and thickening cervical mucus to block sperm.
نعم، واضح جداً.
Now, remember, it's important to apply the patch to clean, dry skin and rotate the application site each time to reduce irritation. The patch is over 99% effective with typical use, but it may be less effective if you weigh over 198 pounds. Common side effects include skin irritation at the application site, breast tenderness, and changes in menstrual bleeding.
نعم، وسمعت كذلك أن فيه هرمونات في اللولب. هل هاي الشيء صحيح؟
Yes, there are two main types, hormonal IUDs and copper IUDs. Hormonal IUDs release a small amount of progestin, a hormone similar to the one found in birth control pills, into the uterus. They prevent pregnancy by thickening cervical mucus, which makes it difficult for sperm to reach the egg, and by thinning the uterine lining, which makes it less likely for a fertilized egg to implant. The most common hormonal IUDs available are Mirena, Skyla, and Liletta. They can last between 3 to 7 years, depending on the brand. Copper IUDs, on the other hand, do not contain hormones. They work by releasing copper into the uterus, which creates an inflammatory reaction that is toxic to sperm, preventing fertilization. The most common copper IUD available is Paragard, which can last up to 10 years.
ممتاز. شكراً للمعلومات الهامة. وهل ممكن تعطيني معلومات عن الزرعة؟
Absolutely, implants are small, flexible rods that are inserted under the skin of your upper arm. They release a hormone called progestin, which prevents ovulation and thickens cervical mucus, similar to hormonal IUDs. There are currently 2 types of contraceptive implants available, Nexplanon and Implanon. Both are highly effective and can last for up to 3 years.
طيب، وإيش هو الفرق بين النوعين؟
The Nexplanon is a single, flexible rod about the size of a matchstick that is inserted just under the skin of your upper arm. It releases a steady dose of progestin over a period of 3 years, effectively preventing pregnancy. Implanon, on the other hand, is a single rod that was used previously but has been replaced by Nexplanon. Both implants are highly effective and have similar mechanisms of action.
وهل ممكن أنا اللي أحطها وإلا لازم طبيب؟
These implants are inserted by a trained healthcare provider in a quick, outpatient procedure. The insertion site is usually numbed with local anesthesia to minimize discomfort, and the procedure takes only a few minutes. Once inserted, the implant provides continuous protection against pregnancy for the duration of its effectiveness. It's important to keep in mind that while contraceptive implants are highly effective at preventing pregnancy, they do not protect against STDs.
شكراً لك على الشرح الوافي. لقد اتخذت قراري وسوف اختار اللاصقات.
You're welcome. I'll provide you with a prescription for the contraceptive patch, and you can pick it up from your preferred pharmacy. I'll also demonstrate how to apply the patch and answer any questions you may have. Remember to start the patch on the first day of your menstrual period for immediate protection against pregnancy. If you have any concerns or experience any issues while using the patch, don't hesitate to contact us.
شكراً جزيلاً على المساعدة. ولكنني الآن أعاني من بعض الآلام عند التبول ووجع في البطن. هل انتظر حتى تختفي هذه الأعراض؟
It's crucial to address these symptoms promptly to rule out infections or other complications that may be causing discomfort. Let's start by examining you to determine the cause of your discomfort. Please lie back on the examination table and bend your knees, placing your feet in the stirrups. This will allow me to properly examine your vaginal area. I'll begin the examination. I'll first visually inspect the external area for any abnormalities or signs of infection. Please let me know if you experience any discomfort during the examination.
حسناً.
Now, I'm going to insert the speculum into your vagina. It may feel a little cold and slightly uncomfortable, but it shouldn't cause you any pain. Take slow deep breaths to help you relax. Now, I'm going to use a swab to collect samples from your cervix for testing. You may feel a slight pressure or tickling sensation, but it shouldn't be painful. Just try to relax as much as possible. That completes the internal examination. Everything looks normal, but we'll wait for the test results to confirm. We would also need to collect a urine sample to check the urine for any possible infection, and based on the results, I may prescribe a course of antibiotics.
نعم. لقد سلمت عين من البول بالفعل لما جئت بالصباح. ولكن كنت أريد أسأل عن الأدوية. هل ستكون آمنة؟ أو هل يوجد أعراض جانبية لها؟
Yes, the medications are safe for you to take. However, like all medications, they may have some potential side effects. For antibiotics, the most common side effects include stomach upset or diarrhea.
شكراً دكتورة.
You're welcome. If you have any further questions or concerns, don't hesitate to reach out. And I'll have the nurse call you with the results of your urine sample and send you the prescription to your pharmacy in case you have a UTI.
حسناً. لا مشكلة.
Please wait here for the nurse to give you the summary of your visit and schedule a follow-up appointment in 2 weeks so we can monitor your progress.
نعم. سأنتظر. شكراً جزيلاً.